What is neurogenic bladder? Neurogenic bladder is a broad term used for someone that has bladder or urinary issues because of diseases like spinal cord injury, multiple sclerosis, and Parkinson's disease. But neurogenic bladder goes beyond just the bladder. It includes the entire lower urinary tract, or LUT. The bladder connects to a urethra, which is a tube that empties urine. There are muscles in the urethra that make up the urinary sphincter. The urinary sphincter muscle has to open in order for the bladder to push the urine out and empty. It must stay closed when the bladder is storing urine. A better term for this is neurogenic lower urinary tract disorder, but that's a mouthful. So we commonly use the term neurogenic bladder. What are the symptoms of neurogenic bladder? The lower urinary tract has two functions or phases, a storage phase and an emptying phase. The storage phase is when the bladder and the lower urinary tract must hold urine comfortably and store it without you noticing. For instance, while we are talking with friends or while we are asleep. The emptying phase is when we decide to urinate because it's the right time and place, and we are able to empty all of the urine from the bladder. This means almost nothing should be left in the bladder. Because of nerve injury, such as spinal cord injury or multiple sclerosis, the bladder may not be able to store urine or empty the urine. Sometimes both phases are affected. If the storage is affected, your bladder is not able to hold the urine comfortably, and you may have urinary frequency, that feeling you must urinate constantly, urinary urgency, when you have no warning to make it to the bathroom, and urinary incontinence, when you cannot hold your urine and you have leakage. These are all very common in neurogenic bladder. When the emptying is affected, you may have difficulty starting to urinate, or you may not even be able to urinate at all. This is called urinary retention. Both storage and emptying are common problems in neurogenic bladder. Is everybody's bladder affected the same? Neurogenic bladder varies a lot, and every patient is unique. Even within each type of cause, such as stroke versus brain injury, people can have very different symptoms. Each person needs to be assessed and evaluated closely. Does neurogenic bladder ever go away? Unfortunately, it usually doesn't go away for most patients, but a urologist can help you manage your new neurogenic bladder. Can it get worse? When someone first gets symptoms of bladder problems, such as urinary incontinence or urinary retention, they don't know that this can affect their kidneys and their urinary function long term. For example, sometimes when there is nerve injury, the bladder becomes spastic and stores urine at a high pressure. When the bladder storage pressure is high, the kidneys will have a hard time draining into the bladder, causing the kidneys to become swollen and lose their function. This can also cause unexpected leaks and lead to chronic pressure sores and infections. Sometimes urinary retention or incomplete bladder emptying can lead to infections and stones. Good bladder management is very important in order to prevent complications. There are different options to help your bladder store urine, prevent urine leaks, and to empty your bladder in a safe and effective way. The goal is to keep your bladder and kidneys healthy and minimize the burden on you, your caregivers, and improve your quality of life. Do I need a urologist? Neurogenic injury affects the way the bladder stores and empties urine, and treatment exists to manage this and improve a person's quality of life. A urologist is a doctor who specializes in the treatment of urinary problems. The urologist will check your bladder and kidneys regularly and help you decide on the best way to maintain your bladder and keep your kidneys safe, infection-free, and improve your quality of life. Knowledge is key in keeping your bladder and kidneys safe in the long term. Your bladder symptoms are all unique to you. The more understanding you have, the better overall health your kidneys and bladder will have. Take an active role in caring for your bladder and kidney. Managing neurogenic bladder is a long road with many options. The key to success is to actively take part. Anyone with neurogenic bladder should have a urologist and touch base with them annually. This may be by phone or video, but it's essential to keep an eye on the kidneys and how they are functioning. Watch for urinary tract infections, or UTIs, and other long-term problems caused by neurogenic bladder.